Hi, and welcome to another edition of Health with Patricia. With me, Patricia Roxanne Hammond. Today we're discussing penile fracture with Dr. Bernard Tobo. My name is Patricia Roxanne Hammond. Please stay glued to your set and be educated. Okay, so we're discussing penile fracture.
Penile fracture.
What is penile fracture?
Yes, so when you hear the word penile fracture, it presupposes that there is bone within the penis, but it is a misnomer. Basically, penile fracture means that the penis, which is fully erect, when it is forcefully bent, then it develops a deformity. So basically, this is how it happens. If you have an erect penis which slips out of the vagina or misses the vaginal hole and hits a different part of the female anatomy, maybe around the vagina or maybe even the bone, then that erect penis all of a sudden will snap. It will get bent, and it is a kind of acceleration deceleration injury. What I mean by that is the penis wants to enter, then it hits a hard part of the female anatomy, and because of that sudden impact, it just snaps. And the reason is simple. You have the penis having two cylindrical structures. Those two cylindrical structures is what contains the blood and gives you a strong and firm erection. In fact, they are said to be spongy.
Okay.
Yes. And those structures are strapped by a band called tunica, and that holds it firmly and makes the erection even more, formidable. So when you have the penile fracture, then that band around it or even that spongy tissue gets damaged.
That would be very painful.
Very, very painful.
It can kill, right?
No, fortunately.
Because the pain alone, I can just imagine.
Fortunately, it doesn't kill. Just that it causes a lot of distress. Because that band that surrounds it gets snapped. That spongy tissue that's supposed to contain the blood can also get damaged. And some people, it can even be more severe to the extent that the tube that transports urine out, what we call the urethra, also may be damaged.
Whew.
Yes. It characteristically, when it happens, the patient will report to you that in the act of sex, all of a sudden he misses the hole, or comes out of the vagina and is not able to go back to the right place.
I think it will be aggressive sex.
So usually it is due to aggressive sex, aggressive sexual activity, and in our practice, it tends to happen with side chicks. Yeah, why that's so I don't know. I mean,
just to prove that you are man enough.
Well, that could be a reason, or somebody you've not seen for a very long time, and once again you want to
impress.
Yes, you show your debility.
Hi.
So aggressive sex, usually the doggy position or the woman on top.
Okay.
Yeah, those are the main positions which can lead to that. Even innocent positions like missionary position can lead to it if you are aggressive or vigorous. We always say that sex is both a science and an art. So you have to learn how to do it. There are various combination of speeds that you need to adopt. When you need to slow down, you do so. When you need to pick up speed, you do so. But if you are over vigorous, then you may end up missing the hole, and that can cause that. Another scenario which can cause penile fracture, and that has been well reported in the literature, is when men with loose boxers or pajamas all of a sudden turn on their bed. Probably there's a call, and they tend to pick the call, and the penis is erect. Mistakenly, they can land on their penis.
Whew.
Yeah, can land on their penis. It is not as frequent as the one that comes with vigorous sex, but we do get situations like that. Because there are some people who even wake up to go and pee, and just by the doorway, the door hits their erect penis. That can also cause that. Then there's an extreme form, and that is not in our environment. It tends to occur in the Middle East.
Okay.
We call it tagadan. Tagadan is simply forceful bending of the penis, and it is practiced mainly by religious extremists. And the reason is very simple. They view erection as ungodly, as unholy. So something which is supposed to be a morning glory, and indicating to you that, hey, I'm a small female member, but I'm the one controlling everything, and I'm wide awake. Once they have erection like that, they start feeling guilty, and they forcefully hold their penis and bends it. You know, it occurs especially in Iran among a certain sects of, you know, religious extremists. Then vigorous masturbation. Vigorous masturbation can also result in penile fracture. So these are all the scenarios which can be the cause, but by and large is vigorous sexual activity.
So in a situation where during a vigorous sexual activity, the penis ends up bending, does it heal on its own, or what happens? What do you do?
So usually this is what the patients will tell you. When the penile fracture occurs, they hear a pop sound.
Pop!
They hear a pop sound. Then the previously erect and cylindrical penis will assume the shape of an eggplant.
Oops.
Yeah. And that penis will become discolored because blood is accumulating within. It looks darker. And that's when the pain comes. For those who have the tube that brings urine out involved, you may see some blood when they pee or at the tip of their penis. Usually when it happens that way, they become frightened. They become alarmed. You know, when they come to the hospital, especially on time. Time is of the essence. When they come, we have to assure them first. But at the end of the day, where the damage occurs, we have to deal with it to solve the problem surgically.
Wow. It doesn't heal on its own.
So, depending on how severe it is, because, and it is best for the urologist to make that assessment.
Okay.
There are some people out of, should I say, to cover up for their sins in quotes, because you went out to do it with a side chick and you wouldn't want your partner to know. Then they cover it up, and at the end of the day, it may heal. But you may not be that fortunate because it may heal with a deformity.
Okay.
It may heal with a bent penis. So you have an erection, only part of the penis becomes strong, then it bends at a certain point and the other end becomes loose. It can be distressing. You know, I remember a patient who came to the hospital, went on some adventure with a side chick, only for him to be rushed in, and then he begged us to inform the wife, who came to the hospital later, that, hey, we are dealing with a hernia. I said, Massa, which kind of hernia do you find on the penis? There's nothing like that on the sort.
He needs to save his marriage.
So we advised him, we are not going to tell your wife. We are leaving that responsibility to you. We'll tell her something, but not, of course, a hernia. We want you, when you go home, sit down with your wife and confess your sins. Most women are understanding, you know, if you do it very well, you know. So basically, there are some penile fractures if they are not that severe. If the rupture or the snap is not so extensive, they can heal on their own. But let the urologist do that that determination. Most of the people who come within 4 to 6 hours, we take them to theater, and where the damage is, we try to repair it.
And how is it done?
So we have to deglove the penis. Deglove the penis means the skin on the penis. That skin is so redundant. So you can easily make a cut near the head of the penis and remove all that skin down. So you'll be left with a fleshy sort of penis without skin. That helps us to get to the point of injury. And once you get to that point of injury, it's very simple.
Okay.
You use a special material, what we call suture, like a thread, suture. And we closed where that damage is. And then we would bring the skin back.
And stitch it. And how long does it take to heal?
It can take as short as 1 week. Or maybe if we give it extra time, some 2 weeks to heal. But the healing is so remarkable. Just that we advise the patients not to rush back into sex. Yes, very, very important.
Even when you have your morning glory?
There was a time the side chick who caused the problem actually followed the guy to the hospital. We had to sack her away because she was so provocative, even causing problem to the male doctors.
Oops.
Yes, so we had to sack her away. As much as possible, you try to discipline yourself, allow the thing to heal very well, even in the face of strong erections. Sometimes we actually give drugs that, in quote, will knock off the erection temporarily so that the thing will heal very well. And within 6 weeks, to 3 months, you should be back on your road.
Wow, 6 weeks to 3 months.
Yes.
With someone who is active, sexually active?
Well, some people have even started having sex within a month, but I would always err on the side of caution. If you want long-lasting results, your penis to be restored to good health, for you to be back on the road, just give yourself that duration to heal very well, and then you'll be fine. Yes. At least by 6 weeks you should be on the road.
Wow. Penile fracture. Thank you very much, Dr. Tobo.
Yeah.
And very interesting education. I believe you have been blessed with this. Please pass it on. We all need to hear this. All your male partners need to hear this. It has been very educative. And the program has been held with Patricia, with me, Patricia Roxanne Hammond. Until the same time, stay blessed.